Welcome to this episode of Hampton Roads Business Live. My name is Rory Graham. I'm your host, and today we have Dr. Ivor Kaplan from the McGee Rosenblum Plastic Surgery Group in Norfolk. Welcome, Dr. Kaplan.
Thank you.
I think we might want to start by you just giving us an overview of what does your practice consist of?
Well, I have a pretty broad spectrum plastic surgery practice, which involves both the cosmetic side of plastic surgery and the reconstructive side of plastic surgery. So I do things that most people who watch television shows will be fully aware of. The facelifts, the breast operations, the liposuction. I do all that sort of thing in our office operating room, which is at the beach. And I also do a lot of reconstructive procedures, which are usually done in an operating room of one of the surrounding Hampton Roads hospitals.
Okay, all right. Why don't we start with you telling us a little bit about your background? How did you get involved in this, and what kind of, I'm sure you're board certified.
Yes. Well, I really became interested in plastic surgery because of an interest that I have in sculpture and painting, which is something that I've done for many, many years, since I was a child, in fact. Mm-hmm. I did general surgery first as a background to starting in plastic surgery. So I was board certified first in general surgery, subsequently did a residency in plastic surgery here in Hampton Roads at the Eastern Virginia Medical School, and I'm board certified in plastic surgery. And I also did 2 fellowships which were done at the University of Louisville in Louisville, Kentucky, one in hand surgery and the other in microsurgery, the use of the microscope for reconstruction of very, very tiny parts, such as splicing together little vessels, splicing together nerves, in the kinds of surgery which people have heard about, where we move things around, such as replacing fingers that have been amputated, taking a toe from the foot to make a thumb, and hooking the vessels up and making the tendons and everything work like it would in the hand. And also in reconstruction, where we can take tissue from one part of the body and move it around and put it somewhere else and shape it and mold it into something else, such as breast surgery for reconstruction after ablative cancers have been removed by a cancer surgeon. We will often do breast reconstruction using tissues taken from somewhere else, not infrequently involving flaps taken from the lower abdominal area or flaps taken from the back, as well as putting in stretching devices that allow us to use the skin that's there and then adapt it by putting in implants, which we've learned to do from cosmetic surgery. Mm-hmm. So there's a lot of overlay between the two, or overlap between the two, in that a lot of what we do in reconstructive surgery goes into what we do in cosmetic surgery, and vice versa.
Okay, that was quite an involved answer. So let's take that apart a little bit. Let's talk about the reconstructive side. Okay, and let's start with hands. You made a statement to me when I met with you a little while ago that you said that after the face, the next thing to be noticed is the hands. And I never actually thought about that, but you do a lot of hand surgery. Can you tell us a little bit more about that?
Yeah, and most of what we were talking about there was that people have cosmetic surgery done on their face, but they forget about the hands, and the hands give the age away a lot of the time. But having said that, a lot of the procedures which we do in hand surgery are not directly done for cosmetic purposes, right, although that is some of what we do, no question. People want their hands to look younger, and there are all sorts of procedures that we do now that are cosmetic related. Right. For the most part, hand surgery involves function. And the old saying that form follows function is really applicable to the hand. Because if the hand works properly, it usually looks right. And when the hand doesn't work properly, that's when you notice that there's something the matter with it.
Mm-hmm.
So I've always had an interest in the hand because the hand is such an involved organ of the body, if you want to call it an organ. It's composed of so many structures in such a small space. And it's a brilliantly designed piece of equipment. You know, we've tried with robots to mimic what the hand does, and it's almost impossible to make anything that comes as close. So it's always been a real source of interest for me. And as a sculptor, it always interested me. So I've spent a lot of years looking at hands and studying hands, and I have some sculptures here which I can show you that I've done over the years. Sculptures of hands that have interested me. I've done this for many, many years.
Well, when you have to redesign a hand, it's good to be able to have the ability to do something like that, because you have to recreate
you know, and that's the role that plastic surgery has a large part of the time when we're doing hand surgery. Although there are other branches of surgeons that do hand surgery, such as orthopedic hand surgeons. In fact, most people think of an orthopedist when they think of hand surgery. But hand surgery is really a large part of the curriculum of what plastic surgeons do when they're training. Mm-hmm. We do a lot of hand surgery. And my interest has always been in the making the hand look normal in trying to get it to function normally.
Right.
So, you know, I've done this type of thing in the past. This is a hand mudra from yoga. It's the heart mudra of the hand. And these are just things that have interested me. Whenever I think of the hand, I think of its sculptural qualities, despite the fact that there's so much of the hand that you don't see that is really the parts that are interesting in reconstructing.
Now, you mentioned replacing a thumb with a toe or some of the other extreme reconstructions.
Right.
And that's a very long process, isn't it? I mean, that's very tedious.
They are tedious. They take a lot of time in the operating room.
It's under microscope?
And it's done, a large part of it is done under the microscope.
Right. Wow. Okay. And do you see a lot of hand injuries?
We do. I have to say that unfortunately we see a lot. And we see the full gamut of hand injuries from pediatric, you know, children's hand injuries. There's a lot of simple hand injuries that go to the emergency room every day. By simple, I mean just fingertips that have been injured. Kids get their hands caught in the door. They get their hands caught in all sorts of things and cut them or severely burn them or abrade them and really hurt their hands a lot. And so we see them because of the reconstructive element that's part of getting the hands to function again. Mm-hmm. But we also see a lot of adult traumatic injuries. And of course with adults, similarly, a lot of them are recreational injuries, but a large amount of these are things that happen at work.
Right.
You know, injuries that happen in people who are in construction, people working in factories. We see a lot less of them than we used to because of regulations and strong OSHA oversight. You know, they come in and look at these things, and there's a lot of problems when there are a lot of injuries in certain industries. But for the most part, we still see the same horrible hand injuries that we used to, but in much lesser amounts than we used to before. Okay.
All right, so that leads me to the next area that we wanted to mention was the ears. You do a lot of stuff with ears, which is, I've dealt with plastic surgeons over the years, and that's one area that I just have never recorded or talked to them about or whatever, but you and I were talking before this interview. It's very fascinating what you do with ears. Can you tell us a little bit about that?
The same reason that I like the hand is the reason that I like ear reconstruction. It's very sculptural in nature. You know, if you tell somebody to draw an ear or sculpt an ear, it's really hard. It's one of the hardest things that even a very talented sculptor can do. The ears are always daunting because unless you really know the anatomy of how what the normal ear looks like, it's very difficult to reconstruct an ear in somebody who has no ear or just part of an ear when they were born or had it injured. I mean, we see some horrendous injuries to the ear that would surprise you. Dog bites that take the whole ear off is not an uncommon injury that we see in both children and adults. Motor vehicle accidents that rip an ear off. Just simple things like fights, people stabbing each other, cutting each other, hitting each other with broken bottles, cutting the ear, damaging it. But my real interest is more in reconstruction for congenital, which means ears that were not there when the child was born, problems. And a lot of that is hereditary. They do sometimes run in families, but we see them as just isolated abnormalities in children that are born with abnormal or very little in the way of an ear. Or two ears, in fact. Sometimes don't even have any.
So when if they don't have an ear, so just briefly, what's involved in recreating one then?
Well, there's two aspects to it. Some of the really severe congenital ear anomalies don't even have an ear canal. So there's no way that sound can even get into the inner ear if it's there at all. And a lot of time, these children require work on the inner ear, which is done by a very complex form of surgical reconstruction done by well-trained ear, nose, and throat surgeons. We as plastic surgeons don't do that. We are really taking care of the external form of the ear. And that part comes from utilizing whatever skin is there at the time that we're operating, and then taking other structures in the body and forming them in the shape of an ear framework, which we put underneath the skin. And the thing that we use most of all are the ribs, because the rib cartilages in even a 6-year-old are big enough at that age to reconstruct an ear that would be almost full size. And what we usually do is we reconstruct the ear slightly bigger at the age of about 6 or 7 years old than the opposite side, because we know the other side is going to grow slightly as the child ages. But we do know something else from studies that were done by plastic surgeons, that the size of your ear at age 7 or 8 years old is the size it's going to be when you're an adult. They don't really get much bigger after that. So you kind of grow into your ears. Yeah, you grow into your ears.
Kind of like a dog growing into the paws.
Exactly, exactly the same thing. Yes.
Well, that's really interesting. I know that when we were talking earlier about ears, you were showing me a couple of photos, and these photos will be on the page on the page of our site as well. But would you like to show photos that you brought of one of the patients, because that patient had virtually no ear on one side anyway.
This is a before and after of a child operated on with no ear in the one picture and the ear reconstructed in the other. That's and amazing. I think you can see that the side where he had no ear initially is really just a tiny remnant of an ear. There's no ear canal there that you can see. And what you're really looking at is just a little lobule of an ear, nothing more.
So do they fix the ear canal first, and then you do the outside?
Actually, we do it the other way around.
Oh, you do? Okay.
Most of the time, if there's only one ear that's involved, we sometimes don't do any attempt at reconstructing the inner ear, because you can hear perfectly well with one normal ear. The only slight differences are that people with one ear that doesn't work may have some difficulty figuring out exactly where sound is coming from. Our two ears allow us to figure out exactly where the sound is coming from.
Right.
But with one ear, you can hear perfectly well. There's no problem the little boy not hearing his mother calling him to dinner, because he can hear it with one ear.
Right.
But two ears are why we have two ears, is to be able to figure out where the sound's coming from.
Right. And you brought a sculpture of the ear, and that when you actually look at it, it's a really intricate thing.
It's a the ear
You
is a
never
very
think about
intricate
it, you
thing.
know?
This is carved on a piece of soap. And one of the things that we learn, or we are asked to be able to do when we're learning to be plastic surgeons, is to sculpt an ear without looking at anything and see if you can really get to make an ear that looks really reasonable. Because if you're going to reconstruct something, you better know what it looks like before you start.
Right.
So over the years, I've learned to carve ears out of various things. And this happens to be out of soap. And use instruments very similar to what we actually use in the operating room that are really just clay cutting instruments.
All right, so they would make that outer edge there out of rib? You'd use
This
the patient's
entire
rib?
framework and the inner framework there would all be made out of the cartilages taken from the opposite side of the rib cage in that patient. They're bent the right way, your ribs come around like this, and when you bring the right side for the left ear and the left ribs for the right ear, they're easy to shape into the
That's what
shapes
my
that
next
we
question
need.
is. You can shape them.
You can shape and bend cartilage by carefully trimming it and making little cuts in it. You can make it form a round shape if you need to get this part reconstructed. You can form the inner part by doing the same thing and then splicing these little pieces of cartilage together with stainless steel wires.
And then you just use the existing skin over it?
And then the existing skin, we raise it up, make sure we don't damage it, and then place that framework underneath that skin, and then we apply some suction to it with a little tiny cannula that we put in that skin envelope, and it sucks the skin down onto that framework. And that's how you get from this flat area around here into something that looks just like an ear.
Right. It's very impressive. Let me ask you, what is the most, and I know you do a lot of reconstruction, what is the most popular, well, not popular, but what is the reconstruction you see the most?
The one that I see the most is probably breast reconstruction.
Okay, we haven't even talked about that, but,
Right.
but you do a lot of that, I would assume, from cancer?
The majority of that is breast reconstruction from cancer.
Okay, so somebody has surgery or their breast removed or whatever, and you reconstruct one.
Correct. So reconstruction using all the modalities that we have available now for reconstructing breasts, which are really amazing. Right. We've come a long way in the reconstruction of breasts since the early days of trying to just put an implant in and make it look like a breast, because that seldom looked like a breast. Mm-hmm. We have the ability to move tissue around from one place to another using flaps taken from the lower abdomen, flaps taken from the chest area and brought round, as well as more commonly, which is done for probably 80% of all reconstructions now, using what we call tissue expanders first, where we put a balloon that is filled with saline in the chest after the general surgeon has finished taking out the breast tissue, and stretch up the skin a little more and then come back and put in permanent implants, which are now available in nicely shaped forms, ones that we never had available up until actually this year, but have been available for many, many years in Europe and South America. And then do additional reconstruction as necessary, such as making the nipple, tattooing the color into the nipple and into the area around the nipple, which is called the areola. We will tattoo it. And we use tattoo pigments just like the tattoo artists use, and we tattoo the colors into the areola.
Okay. Before I forget, I just looked on my notes and it had mentioned here, and we didn't mention it, but you've worked with Operation Smile, right?
Correct.
Okay, and actually Dr. McGee was
Absolutely.
the founder of that.
In fact, I was on the very first or second Operation Smile trip that was ever done.
Right.
At that time, I was a resident here in plastic surgery in Norfolk.
Well, that must be very rewarding.
Very rewarding. It's a huge, huge undertaking all over the world now.
Wow. and that's very well known. And I've known them in this area for a long time. Let me ask you then. Okay, someone has a reconstructive need, or even a cosmetic need, but let's say a reconstructive need. So what is the process? They call your office and they come in for a consultation, or?
That's correct. We see patients who have a desire for cosmetic reconstruction. Well, not cosmetic reconstruction, although if you think of cosmetic surgery, it's also reconstruction.
Right.
But cosmetic surgery, we usually see patients free of charge. And we will tell the patient what we think they need, what their aims are, and get a general idea of how realistic they are about what they want done. As opposed to patients who are coming in for reconstructive issues, we usually see them based on their insurance company's charges. We participate with just about every insurance company that there is.
Right.
So we see every patient that you can imagine from an entire sphere of problems in plastic surgery, from wounds to hand injuries, breast reconstruction.
Yeah.
A patient will come into our office and we will assess them then.
Now I was going to ask you that because it seemed to me that a lot of reconstructive stuff would be emergency.
Quite a lot of it is. That's true, and those are seen in the emergency room where plastic surgeons, myself included, will often be called into the emergency room to take care of an issue that the emergency room doctors cannot,
right,
that are plastic surgery related. And for the most part, those are wounds from motor vehicle trauma, lacerations, hand injuries, burns, that sort of thing. And those patients will sometimes be hospitalized. A lot of times they will be treated by us in the emergency room and then go home and come back to our office. So you're right, a lot of what we see acutely is trauma related from emergency rooms. But a lot of referral patients come to our offices directly, either from other doctors. For the most part, they'll come to our offices from their primary care doctor, from an orthopedic surgeon, from a pediatric doctor who is referring a patient. They come to us from all different specialties, and the patients are of all ages. We don't see just one age. We could, in my office, I could be seeing children, a young adult, an old adult, somebody in a wheelchair, somebody on crutches, somebody with their hand in a sling.
They all have a body.
They all have a body, and plastic surgeons take care of the entire body.
Right. So it's not always about trying to improve yourself a little bit. Sometimes there's a reconstructive need, or sometimes from birth or an injury or something.
Absolutely.
And that happens an awful lot.
Absolutely.
And that's what you never hear about, that side of plastic surgery. Rarely.
Right.
Yeah.
Because most people can associate wanting their face to look younger, or wrinkles to be gone, or their breasts to be bigger with a plastic surgeon. But nobody who has not had an injury to their hand, or has not had a nerve compression injury or something that a plastic surgeon has taken care of, would even know that that's what plastic surgeons do. You never see that on Nip Tuck or any of those plastic surgery programs, because it's not cool. The cool stuff is looking at cosmetic surgery, because people can imagine having that done themselves. But when they really need a plastic surgeon, we're there because we do all these other things, and we have this knowledge of cosmetic procedures, so that what we try to do, even when we're reconstructing, is make it look normal and as good as possible. We're usually not satisfied with ugly scars and things that don't look normal, even if they do function properly. Right.
Okay, so this has been a very fascinating interview. I learned a lot, actually.
Great.
And like I said, I'm like a lot of the public. We hear a lot about the cosmetic side, but not the reconstructive side. So this is very interesting, and I appreciate you coming in. Is there anything that I did not talk about that you wanted to mention?
I think you covered a lot.
Yeah, I did.
You really did.
Yeah.
In a short time, we covered a lot of things.
Okay, all right. Well, if you have a reconstructive need or a cosmetic need for a plastic surgeon, consider calling Dr. Ivor Kaplan at the McGee Rosenblum Plastic Surgery Group in Norfolk. His contact information is at the end of this video. It's also on the bottom of this page. And we thank you very much for coming in today and being our guest. And that's some beautiful work you have there, and I'm sure the patients and everything are pleased with what you do too.
Thank you very much.
Thank you.
Thank you.